Hello, my name is Dr. Diwan S. Raja. Today I will discuss about anterior spinal artery syndrome. Let's go with the anterior spinal artery first. The anterior spinal artery is formed by the union of two arteries, each of which arises from the vertebral artery. So this is one vertebral artery, this is another vertebral artery, and two vertebral artery contributes in the formation of one anterior spinal artery. Okay. The anterior spinal artery then descends on the anterior surface of the spinal cord within the anterior median fissure. Branches from anterior spinal artery enters the substance of the cord and supply the anterior two-thirds of the spinal cord. So it is almost two-thirds. In the upper and lower thoracic segments of the spinal cord, the anterior spinal artery may be extremely small. The upper and lower thoracic segments of spinal cord, this may be small. When the segmental or radicular arteries are occluded in this region, occluded maybe due to atherosclerosis, due to trauma, due to some type of surgery, some type of disc herniation. Okay. So when the segmental or radicular arteries are occluded in this region, the T4 and L1 segments of the spinal cord are particularly liable to be ischemic necrosis. So this artery goes along the anterior median fissure downward through the thoracic segment of spinal cord and up to the lumbar one spinal cord, where the spinal cord ends. Okay, this is the vasculature, and we are seeing two vertebral artery. Vertebral artery are branches of the subclavian artery, goes through the transverse foramen of the vertebra and go inside the cranial cavity through the foramen magnum, forms the basilar artery. Okay, but before forming basilar artery, vertebral artery give rise to two branches from two sides and give one anterior spinal artery. This is anterior spinal artery that is present in the anterior median fissure. This is the anterior spinal artery. Okay. We have one anterior spinal artery, two posterior spinal artery. These are two posterior spinal artery. And the anterior spinal artery is bigger and it contributes around two-thirds of the spinal cord, including both white and gray matter. Posterior one-third area is mostly supplied by the posterior spinal artery. There is anastomosis between the anterior and posterior spinal arteries. Okay, we have also some radicular branches, segmental or radicular branches. They are the branches from the local area, from the intercostal artery, maybe from the descending thoracic aorta. Okay, so these are the radicular arteries or segmental arteries. They help to supply the spinal cord as well as the spinal arteries. We are looking one of the radicular artery is very large. We call it artery of Adamquiz, also arteria radicularis magna. Okay, it may be in the left side, maybe in the right side, and it is present around 70 to 85% population. So this is the arteria radicularis magna. This is the anterior spinal artery. Okay, anterior spinal artery may be in some places is thin. Okay, these all arteries are supported by the radicular arteries. This radicular artery is a branch of the intercostal artery, and this is the artery of Adamquiz or articular or artery of Adamquiz or arteria radicularis magna. The anterior spinal artery supplies anterior two-thirds of the spinal cord. Posterior spinal artery mostly supplies the posterior one-third, maybe partly to anteriorly. So anterior spinal artery supplies more than 50%, usually around 75% of the spinal cord, both white matter and gray matter. And there is anastomosis between the anterior spinal artery and the posterior spinal artery. Anterior spinal artery syndrome, when the anterior spinal artery is blocked, compressed, we'll get anterior spinal artery syndrome. It is also called anterior cord syndrome. Anterior spinal artery syndrome is a neurological condition caused by ischemia, lack of blood supply in the anterior spinal artery, which supplies the anterior two-thirds of the spinal cord. It is typically results in motor and sensory deficits below the affected spinal level. What are the causes of anterior spinal artery syndrome or anterior cord syndrome? It is one type of stroke because artery is blocked and the spinal cord is not getting blood supply. Causes atherosclerosis, narrowing of the blood vessel, aortic pathology, that is aortic aneurysm. Aneurysm is the abnormal dilatation of the blood vessel. Aortic dissection, one more channel is developed inside the wall of the aorta, particularly descending thoracic aorta, or post-surgical complication. Embolus or thrombosis may also block the anterior spinal artery. Spinal trauma, fracture or herniation. Vasculitis, inflammation of the blood vessel. Hypotension or hypoperfusion, that is during cardiac arrest or surgery. Spinal cord tumor compressing the artery. So these are the causes of anterior spinal artery syndrome, also called anterior cord syndrome. Okay, if you go to the clinical feature of anterior spinal artery syndrome, motor deficit, bilateral paralysis or paresis due to corticospinal tract involvement, anterior horn and lateral corticospinal tract will get the motor deficits. Presents as flaccid paralysis initially due to spinal shock, later evolving into spastic paralysis below the lesion. Sensory deficit, loss of pain and temperature sensation, spinothalamic tract involvement below the lesion, preserved vibration and proprioception, dorsal columns paired as they are supplied by the posterior spinal arteries. Autonomic dysfunction, possible urinary and fecal incontinence due to autonomic fiber involvement. In the high thoracic or cervical lesion, there may be autonomic dysregulation, including blood pressure and instability. Okay, spinal cord, we know that the sympathetic segment of spinal cord come from the lateral gray horn, so that part is usually damaged in anterior spinal artery syndrome. Okay, there will be urinary and fecal incontinence. Okay, what is the diagnosis? Diagnosis: MRI of spine helps rule out compressive causes, tumor, hematoma, and assess infarction. CT angiography can identify vascular occlusion or aortic pathology. Spinal angiography, it is a vascular malformation. If a vascular malformation is suspected, lumbar puncture to assess the CSF to exclude infection or inflammatory causes. Okay, our idea to diagnose the anterior spinal artery syndrome or anterior cord syndrome, cord, C-O-R-D, cord. Management, supportive care, maintain perfusion pressure, fluid resuscitation, and oxygenation. Treat underlying cause, that is anticoagulation or embolic causes. Surgery for aortic dissection. Rehabilitation, physical and occupational therapy for functional recovery, bladder and bowel management to prevent complications like infection or constipation. So mostly supportive. It's a nervous damage and nerve will not be repaired in the spinal cord. So we have the supportive care, treating the underlying cause. If there is embolic condition, giving anticoagulation, rehab by physical and occupational therapy, bladder and bowel management by training, okay, and also by preventing complication like infection or constipation. Diagnosis: MRI of the spine, CT angiography, spinal angiography, lumbar puncture. Prognosis: recovery depends on extent of ischemia, timing of intervention, and underlying cause. Many patients do not recover full motor function, but some regain partial function with rehabilitation. Risk of chronic disability if the damage is extensive. And that's all about anterior spinal artery syndrome, or anterior cord syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.